Live first.
Okay.
Okay, hello everybody, and welcome to today's GFED. We'll have a really exciting topic. We have Dr. Salduker in the building, and we're going to be talking about stress and anxiety during these times of COVID. Doctor, hello and good afternoon. How are you doing today?
Hi, good afternoon to you. I'm fine. How are you?
I'm doing great. I'm doing good. Excuse me, did I pronounce your name correctly?
That's perfectly right. Dead on.
Okay, awesome. Because anyone who's been watching me here long enough knows I butcher the pronunciations of names. So I'm glad I got that one right.
Well
So
done.
tell us, doctor, tell us a little bit about the stress and anxiety and how it's become a thing, more especially during these tough times we've seen ourselves in the last year and a bit.
Yeah. So when the COVID pandemic started in March last year, um, there was a lot of unknown that was hitting the world. So it wasn't as though you could turn to other parts of the world and find out what they did. Everyone got hit at the same time. So we had a huge unknown factor that came into our lives. And then we had lockdown, which changed all our lives. And from March last year, right up till now, it hasn't gone back to normal or the normal that we know it as. So during the first wave and the first lockdown and the hectic sort of changes that we had to go through, there was a lot of thought put into what was going to happen to people after the virus had gone or when the pandemic had ended. How was all of this being exposed to the unknown and being locked down and not being able to socialize or work, or some people earn a living? How was all of that going to impact on people, obviously, that survived the pandemic? And that's when there was this sort of talk in sort of middle of last year about this thing called the second wave in a broader sense. The second wave of the COVID-19 was not the virus, but actually the mental health impact it was going to have on the world. So there was some research done, and there was a lot of collaboration between different countries. So what they ultimately came back with was that they expect that there would be that this event was traumatic, and that there would be a lot of post-traumatic kind of emotional and mental health issues. So obviously, that was all speculation at that time. Humankind has got a tendency when in a crisis to bear down and just not think about the future too much. But obviously, as the crisis starts to lift, that's when they start to look within themselves and look at the impact that it's had on them. So during the crisis, nobody really thought about the mental health issue. They just were too busy surviving and getting through lockdown and learning how to live. But obviously, as time passed on and the first wave of the virus passed, there was this fallout, this mental health fallout, where a lot of people who never really there was a, there were groups of people, those that had existing mental health issues and those that didn't have existing mental health issues. All of them started to so you must
Uh,
there,
Sorry, you're
there's
you're
got
breaking up a little bit there. Do you mind repeating that last statement?
I said human beings in general have a few things in common that we fear. Obviously,
Mm,
the most fearful thing is the loss of life. So anything that threatens life becomes a fearful incident. The
mm,
next sort of important thing that human beings fear is the loss of health, loss of well-being, loss of um, the inability to be healthy. And this virus threatened the loss of health. It threatened the loss of life. And then the third thing people fear mostly as a group, as a population in the world, is a loss of earning, a loss of ability to sustain oneself. So that was also so now all these things that we fear most in our lives, our health, our wealth, and our happiness and our lives, was put at risk during the
mm,
beginning of the COVID-19 pandemic. So when you take the word fear and you find synonyms for it or words that mean the same thing. Clinically, the most commonly used word that is equated to fear is anxiety. So, as a result, COVID 19 increased the world's anxiety levels, all the way from the leaders at the top to the most poor of poor. Everyone got more anxious. Why? Their lives were in danger, their health was in danger, their sustenance was in danger. And of course, their family members, their relatives, their friends. There was a lot to be afraid of. So, as your fear levels rise, so your anxiety rises. And what anxiety means essentially is an increased level of vigilance within the human being. So, in other words, always on the lookout, always checking, always thinking
Mm,
ahead, always trying to plan for something that you can't really control. And that anxiety can be manifest in a couple of ways. One is your thoughts, because you have a lot of these scary thoughts that can become so bad that you start often getting paranoid. You think you got the bug, you think you're going to die, when actually nothing's happening. So that's the extreme of anxiety is paranoia, up to very simple physical symptoms: palpitations, dry mouth, sweaty palms, lightheadedness, chest pain,
mm,
difficulty breathing. All of these can happen at different times, some together, some alone. But these are all, your stomach, for example, has got a very strong link. They call it the gut brain axis. So your link between your stomach and your brain is very strong. So anxiety is one of the common things that affects people's stomachs or gastrointestinal tracts, which leads to things like irritable bowel syndrome or irregular bowel habits or bloating or discomfort. So all of these things, the thought processes and the physical symptoms, are the anxiety that people started to experience as time went on. Now, it's important to understand firstly the brain is a very powerful organ. Just to give you an
mhm,
example of how powerful it is, there are cultures that are very, old cultures that go back many hundreds of years, where
mhm,
the witch doctor or the shaman is like the most powerful person in the village. Now, I'm talking about cultures that have not been exposed to Western medicine and science and so on. And in anthropological studies that were done, they showed in the past that if a shaman or a witch doctor said to somebody in a village, "You're going to die on Tuesday at 8 o'clock," that person would drop dead and be genuinely dead. And that's the
okay,
power the brain has. That's the power of belief. They believed that they would die at that day, at that time, and the brain shut the body down. I mean, that's an extreme example, but just take that and extrapolate that slightly, and you'll understand how the brain can affect just about everything that we do: our blood pressure, our temperature, our pulse, our digestive system, our breathing, our swallowing, our vision, our hearing. Everything can be affected by the brain. So if you put a brain that's been under a lot of duress and anxiety is a chemical state the brain goes into when it's stressed. And I think it's important to understand the difference between stress and anxiety.
mm,
Stress is an external influence that we have to deal with as human beings. So the COVID 19 pandemic was a stress for the human being.
okay,
Then we've got what is called a coping mechanism or an ability to deal with stress or a filter, as it were. So, how much does that stress affect us? How much that stress affects us, and if it becomes a chemical change in our brain, becomes anxiety or clinical anxiety. So stress is the external pressure, our reaction is the anxiety. So not everybody obviously became clinically anxious, but generally the baseline level of stress reaction or stress reactivity went higher. So as a
mm,
result, people became their sleeping patterns changed, their their ability to get joy out of things, the things that they enjoyed doing, they did less. Um, you guys would know from a exercise point of view that people's exercise motivation and patterns got less as a result. People were afraid of suddenly it wasn't that important to worry about your weight and your exercise and other things. Suddenly you just have to be careful that you don't die or get this dreaded disease, you know. So priorities changed. So I think the importance of acknowledging the second wave of the COVID-19 pandemic is that a lot of people become ill, even though they haven't been infected by the virus, because of the effect that it has on their mental health. And what that then leads to is the quality of life changes, relationship changes, productivity changes, taking care of oneself, and all of those things take a backseat. So,
Mm,
in the context, I think the reason I think this talk was important, and I think we needed to kind of get it out there, was that it is something to stop and reflect on. You can't always take your vitamin C and your zinc and your multivites and think you're okay, because that's looking after the physical body. But what about what this has done to us emotionally and mentally? How have we changed? Are we a bit more short-tempered and irritable with our kids? Are we more
mm,
emotional? Do little things make us want to cry easier? Are we always checking? Are we always? I mean, everyone's now washing hands and making sure masks are on and physical distancing. You're on a state of hypervigilance 24/7. You know, so all of those things must have had an impact. And all the point really is we need to take stock and reflect and look at ourselves and see how it's impacting on our lives, and then look at ways in which we can reverse that or dial it down a little bit or go back a little bit. Because if you live with anxiety and let's say you happen to be one of the unlucky people that gets the viral infection,
mm-hmm.
the the effect of anxiety on having COVID is that anxiety is going to suddenly make you think you're getting all the severe symptoms. There are many patients that come into the hospital that I work at who say they can't breathe, but their lungs are absolutely fine. The X-rays are fine, but they say they can't breathe, and they think they need to be in ICU or put on oxygen. It's all anxiety. So it's important from the viral point of view not to be anxious when you get the bug, but it's also important from the non-infective point of view not to live our lives constantly in fear and constantly ending up uh, waiting for this virus to attack us. So there's many reasons why anxiety is important during the COVID pandemic. I think I've lost you there. Ah, you come back.
Sorry, broke up there for a second. But I wanted to
Yeah.
ask you, like, so let's say you're someone who is struggling with that anxiety right now, and you're unsure of what to do, how to make those changes. You've reflected, and you realize you are suffering from this semi-chronic anxiety. So, what are some immediate steps you can put in to sort of like help mitigate and resolve that?
So I think the most important thing is, maybe if you remember, if you recognize something as being foreign to your normal being, as being foreign to your um, normality, that's going to make you feel uncomfortable. So if you have a sense of discomfort that exists every day, most parts of the day, for more than a few days, maybe going on to a week or 2 weeks, it's best to go and have a chat with somebody. You can chat to your general practitioner, you can chat to go to a clinical psychologist or a psychiatrist if you think it's really bad. But ultimately, any change in your normal level of comfort that persists and that leads on to changes in sleep pattern or appetite or level of your ability to enjoy things or get pleasure means something's going on. So don't ignore it, because the longer you leave it, the deeper it becomes entrenched into your normality. And the problem is we often see people months and months down the line when their productivity, their relationships, their quality of life has suffered so much that it's difficult to kind of get back from that. The trick is to pick it up early, and if you think you're not feeling yourself for more than a week or two, go and get checked up. Go and speak to somebody who knows how to, determine what is clinical and may need assistance, and what is just a normal adjustment to what we're living through right now.
Okay, okay. Because I know I've recently myself started seeing someone for very similar reason. And one of the first things he told me is that it's trying to identify some of the because the overarching anxiety is coming from the times we're in, but oftentimes we have like particular stressors. So trying to figure out exactly what the root cause behind your particular anxiety is, and trying to work with them to figure those things out. Some of the advice you give me. So is how would you advise others to try and the process of figuring out those particular nuances to it?
So that's the thing about COVID, right? It's a background anxiety that's there for everybody. So uh, so the rest of life goes on. So all your normal anxieties are still there that were there before COVID. All they are now is they're going to be heightened. They're going to be, they're going to be put onto steroids now because anxiety is in the brain is one place. It doesn't have like a home anxiety and an illness anxiety and a work anxiety. It's all one thing. It's the way you can imagine anxiety is like a big pot in the brain that fills up. The greater the level of fluid in that pot, the more pressure that it's going to come out of the different pipes at the bottom. So those are different
Mm,
ways anxiety presents itself. So if you've had anxiety, and most people, the only people who don't have anxiety are dead people, basically. Everyone else has got a degree of anxiety at some
mm,
stage, and actually it's a healthy thing to be a bit anxious because it allows us to function. It makes us punctual. It makes us complete tasks. It makes us worry about what other people think. So normal anxiety, if you think of it on a spectrum, is sort of between like say 30 and 60% anxiety. That's good anxiety. You need that. Anything less than 30, say, people who are too laid back, don't worry about completing tasks, too chilled, not motivated. Anything over 60 makes you physically unwell. So if you're in that 30 to 60 bracket, that's cool. That's good anxiety. You want that. But lots of people have that and some, and then some, where by nature they're a little bit anxious. They're warriors by nature or they're perfectionists by nature. So for them, it'll be a little bit over the 60. They'll be in the 70 to 75% bracket. But again, fairly functional and getting things done. But they're people who are warriors and are always on edge and sometimes hard to be around because they're always trying to be, just right and complete things and get things done and they just and then these are the kinds of people that you think in your head, geez, you need to chill a little bit, because they're a little bit too anxious. But for them, it's okay. So that range of anxiety is what we're coming into this COVID pandemic with. And as a result of the pandemic, it's now elevating it by another 10 or 15%. So it's going to push a large proportion of people into that 75 to 80% bracket where they're now going to get unwell. And that's when you either need psychotherapy or see a clinical psychologist, or if, I've been very lowered my threshold during this 18 months of the pandemic to prescribing medication for people that need it. Previously, before COVID, we have to be absolutely certain that you do need to go onto the treatment before we prescribe it. Now,
mm.
because of everything that's happening for me, I've lowered the threshold. I've become a little bit more compassionate towards what might be happening that we may not be seeing. Because obviously, this is not going to end anytime soon. So we have to also prepare people for the next year and bit to come. So we've been using a lot more of anti-anxiety treatment in the last 12 to 18 months. The psychologists have been doing what they can. Um, you know, people are reeling. They don't know. Nobody's really got a plan. Everyone's taking the tools they have and trying to help with a problem that we don't really know fully. And as you know, every day, every week, every couple of weeks, it changes, and then something new. Just when we think we sort of getting there, then something new happens. Another variant comes out, or yeah. So it's a hell of a lot of unknowns that we're dealing with, which means anxiety and fear of the unknown is going to be a very big part of our lives for the next few months.
So for those who feel like they're not quite past that 60% threshold, but feel like they are dangerously teetering towards it, are there a couple things that you can do in your everyday life to sort of like mitigate some of that overall anxiety, overall try and de-stress yourself in a very pragmatic sort of way?
So if you're not clinically anxious, if you're just feeling yourself uncomfortable, but you don't have like panic attacks or your sleep pattern's okay and so on, there are a few very basic things. If you just look at them from a lifestyle point of view, so from a dietary point of view, cut out all caffeine from your diet because caffeine is a hell of a big anxiogenic substance, or in fact anything that can be regarded as a stimulant. Now, remember, a lot of the exercise-based pre-workouts and so on have large amounts of caffeine and ephedrine in them. So those are things to avoid at times like this if your anxiety levels and your stress levels are a bit high. And activity levels point of view, there is no substitute. In fact, many studies now are showing that endorphins that your brain produces in response to activity is as good as seeing a psychologist and doing clinical psychotherapy. That's
Okay.
how good exercise is. So exercise is more and more becoming up, climbing the ladder of therapy, of a form of therapy. But it has to be done. You can't say I'm going to go for a walk for 20 minutes. That's not exercise. You need to get that endorphin effect. You must remember endorphins are the body's internal pain control mechanism. So it's the same as taking morphine. So anyone who's taken morphine or pethidine or any opiate-based drug will know how good that feels. But here you have
Mm,
it naturally, though it's not causing any harm and giving you a sense of well-being, and that can sustain for anything up to 6 to 8 hours after your exercise activity, which means if you're exercising in the morning, at least till 2, 3 in the afternoon, the endorphins have you covered. So if you adjust your diet, you exercise, and then you start to, so for me, one of the biggest problems with anxiety is everything in the person's mind or brain gets speeded up. Everything happens too quickly. The thoughts happen quickly. They want to fix things quickly. So one of the things to learn is to slow down. And how do we slow down? We slow down by becoming conscious of our breathing, as one example. So we start to think about how we breathe. We measure our breath in, we measure our breath out, and we do this consciously. There are many forms of conscious breathing, transcendental meditation. There are many breathing exercises, progressive muscular relaxation, and so on. But I mean, you don't have to get too fancy, but just to become aware and also slow down. So, it sounds like a super easy thing to do, but it's really difficult if you
mm,
are rushing, if you feel like the world's coming to an end and you have to get everything done immediately. Slow down. Because the reason anxiety becomes a problem is because it's your brain goes so fast that you can't actually be logical and reasonable. So you end up becoming irrational, and you end up becoming you catastrophize everything. It's like thinking of the way I explain it to some people is if I tell you to go and stand at a busy freeway which has like 5 lanes going in different directions, and the cars are going at 120, 150 k's an hour, and I tell you to count all the Toyotas, you might get 1%. But if I tell you to stand on the
mm,
side of a road with 2 speed humps where the cars go at 60 k's an hour, you'll get 100% right. And that's how the brain works. The faster and more chaotic it is, the less we absorb and can translate into action. The slower it is, the more we can absorb and translate into action. And people think that's going to take longer. So if you take longer, something's going to happen. Actually, it doesn't take, in fact, it takes a lot quicker to slow down because you're more effective. And if you're speeding up, you're going to do 5 different things before you get the thing right. So it's better to slow down and
mm.
get it right. Yeah.
I find that was one of the major problems I've been having lately is that struggle to just slow down because the hustle and bustle of the world as we know it right now is a bit of a thing. So I found in the overall anxiety and pressure to speed up what I was doing was starting to become an overarching theme. And because you don't just speed up in one aspect of life. It's sort of like it started bleeding into every other aspect of my life, and eventually, at some point, you're like, okay, listen, like I'm way too anxious, way too often. I need to make a change here, which is one of the reasons I started seeing someone to help me like because oftentimes I feel like it's we because everything you've said so far almost sounds like it should be intuitive. Like there's nothing that sounds too not obvious. But oftentimes, like hearing someone else tell you what you already know in a different voice is like, oh, it clicks just a lot better. And that's why I
100%.
find the benefits of being able to talk to someone like yourself.
Mm. And it's important to understand that when we're talking about this at a very, very basic level in terms of lifestyle changes and so on, but at the biological level, stress releases a compound called cortisol in the brain. Cortisol is responsible. It's a steroid. So think about what happens to your body when you take a lot of steroids. Your blood pressure goes up, your pulse rate goes up, your digestive system goes haywire, your brain starts to race. That's all the effects of cortisol. So what we want to do is try and counter how the or the body reacts or the human being reacts to having too much of the stress hormone circulating through their system. So it's almost like we want to be anti-steroid about what we're doing. So we want to slow down, we want to calm down, we want to sleep better, we want to eat well, we want to regulate our body function.
Now, Doctor, this has been a very, very informative talk. Thank you for coming. A couple of the comment sections are reiterating that. We have Nadine saying, yes, natural sweat is medicine. Love that. We have Catherine Herman's sharing that she had a bit of a meltdown this past Saturday. The lack of fresh air and exercise started to hit her hard. This COVID has been something else. So it's definitely what you're saying. It's the whole just being able to exercise, try and reduce stress, overall stress, anxiety. It has an impact. We can't keep our anxiety levels too high for too long and continue to live like happy, fruitful lives.
100%. Yeah.
Now, so this has been amazing, guys. If you have any questions, I urge you to pop them into the comment section now. But in your closing words, Doctor, like what would you have to the average viewer listening to us now? What are some take home words that you want them to gravitate towards?
So look, I think the one thing that comforts humanity in general is knowing that we're all in this together. So we really are all in this together. And, it doesn't take much to be cognizant of the next person, to try. And this is a good time. I mean, COVID has done some terrible things to the world, but it's also done some amazing things to this world in the sense that it's made us all slow down. It's forced us to slow down. It has made us, because of lockdown, because of restrictions, because of the inability to travel, it's forced us to stay in one place. It's forced us to start becoming more mindful. Now, COVID lockdown has been called the biggest exercise in mindfulness in the history of mankind. It's forced us to think about what we're thinking about and what we're feeling. So as much as we think about what we're thinking about and what we're feeling, I think we need to extend that to people that we encounter, because we may be slightly less anxious about getting the virus. There might be another person out there who might be a lot more anxious. And it tends to become a problem in terms of how we relate to each other. We're standing in a queue in a shopping center or at the supermarket, and the person gets a bit annoyed because you're getting too close. Everyone's edgy, everyone's tense. It's important to understand that you might be anxious, that person might be more anxious about it. So I think one thing for me is the fact that we're becoming more mindful about how we feel and what we think, become more mindful of what other people are thinking and feeling. And this is a great time to become better humans in general, just because if you think about it, a lot of the material things that we chase every year, overseas holidays and this, the cars and all of those things have come to a grinding halt. So what are we focusing on? We're focusing on ourselves, we're focusing on our relationships, we're focusing on our health. So it's a great time to start becoming better human beings, to start becoming better friends and neighbors and relatives and spouses, because this is a great time for people to stop and take stock and kind of use that to change direction and go down a better path than we've been going till now.
Dr. Salduker, this has been an amazing talk. Thank you so much for giving us your valuable time. It has been much appreciated. I've taken a lot from what you've said just now, and definitely going to work on trying to implement some of this into my, like today even, try and implement a little bit of that today to try and slow down a little bit and just try and be an overall better person. So thank you so much for joining us. Everyone watching at home, thank you for tuning in. If you guys have any questions, continue to pop them in the comment section, and we will relay them to Dr. Salduker, who will give us a little bit of feedback. And if you guys enjoyed this and you want more Jeff Eds just like this, let us know, give us some feedback. Hope you guys have an amazing Tuesday, and we will see you in the next one. Thank you.